and welcome back to the Motherhood Unplugged podcast. Today I have Dr. Claire with me, and I'm so excited we'll be discussing all things pregnancy, childbirth, and all of that good stuff. But before we begin, I just want to thank Ashley Furniture Home Store for sponsoring this podcast. Hi, Dr. Claire.
Hi.
Thank you so much for being here. I really appreciate your time and you, joining me on this.
Thank you for the invitation. I feel like we've come a long way now.
We really have. So for those who don't know, Dr. Claire actually delivered Olive. Dr. Claire was my OBGYN, and so it was my first pregnancy.
Yeah.
And I guess it was the scariest time of my life, but you really helped me.
I remember how nervous you were.
I was so nervous, exactly. Literally, and I even remember you were on dial as soon as I gave birth. Like every time I had a question, I'd be messaging you about like the most random things. Is she breathing? I didn't hear her for 1 second. But you really helped me and walked my hand through that entire journey. And it was an experience. But maybe before we begin, you could just share about who you are and what you do.
Right. Okay. So as you know,
yep.
I'm an obstetrician and gynecologist practicing here in Nairobi. I'm also a digital creator, so you can find me on social media pretty much everywhere, as well as now a podcast host where I host Circling the Rabbit Hole podcast. Yeah. We talk all things controversial and taboo when it comes to sexual reproductive health. Just because I think we need to destigmatize these topics. Yeah. I
mean, I definitely think that's a huge thing, and I didn't realize how big that was until I had my own kids. And then you just hear anything, you talk about motherhood, pregnancy, how you're dealing with anything regarding your parenting journey. Somebody has something to say, and it's just like very taboo. You shouldn't be saying that, especially within Kenya.
True.
I mean, also the older generation don't want to hear anything like that. So it's really interesting that you started that. And so before we dive into some of the questions I had, we were just talking about, how having an OBGYN is a privilege here in Kenya. And I think I personally still didn't understand that until we had this conversation.
Right.
So maybe we can dive into that a little bit more, because for me, it's such a natural thing to go to your OBGYN and then go and deliver in hospital. But maybe you can explain why, that's just not the case around the world.
Right.
Yeah.
So as an OBGYN, we're trained specifically, because, divide them. There's obstetrician and gynecologist. So obstetrics is the pregnancy-related medicine, whereas gynecologist is reproductive health outside of pregnancy. And some countries train in one or the other, whereas here in Kenya we do both. Okay. So your OBGYN is basically your OB is also your GY. So then in Kenya, just because of the way the healthcare system is set up, we have a lot of obstetricians available to you directly. Yeah. Whereas across the world, it's a referral system. And in a normal pregnancy, typically you can be looked after by a midwife from beginning to the end, and they'll deliver you because that's the training. Yeah. And then the doctor comes in the high-risk situations. If there's complications or if there's an issue during the pregnancy, the midwife will pick up on it and refer you to the gynecologist. So when you come in here, because then it's taken for granted that you can come into an OBGYN's office and start your clinics right from the beginning, and we follow you through and we deliver your baby. It's great because then you have top-notch care, but then it's also not necessary, because I see a lot of mums, this is, again, some of the issues that mums will suffer from is getting judged for things maybe just because of lack of understanding. So I've seen mums who've been given grief in terms of, you should do better, get a doctor, you shouldn't be with a midwife, you should see a gynecologist. But to be fair, it's expensive and it's sometimes unnecessary, especially if your pregnancy has no risks whatsoever. And you can journey the whole way through with a midwife. Okay. And in most hospital-based practice, that tends to be the case. You'll start off with midwives. If there's a risk, then they'll refer you to the gynecologist.
Okay, and what are some of these high risks that,
so things like anemia or a low iron in pregnancy. If you have a risk for gestational diabetes, preeclampsia, which is hypertension in pregnancy, or if your baby is in the wrong position, multiple pregnancies, multiples in pregnancy as well, so like twin or more pregnancies, then you're going to have to see the doctor. Yeah. As well, now sometimes your doctor, your first contact will be in the delivery room during the birth. So if you have complications during the actual birth, so either bleeding excessively after pregnancy, or if the baby gets stuck in things like shoulder dystocia, or a malposition or malpresentation where the baby's head is not the leading part, then a doctor needs to attend that delivery.
Wow, okay.
So then also will come in also postpartum. So you might have had a normal pregnancy, no issues with your delivery, and then issues arise after delivery, and some of those, again, bleeding, very low HB because of blood loss during the birth. We also have a preeclampsia, which is hypertension, showing up sometimes after the delivery. Sometimes also then we come in with mental health issues, because you can have postpartum depression or postpartum psychosis, which is not something a midwife is going to handle. So then a doctor would come in.
Okay, and then in terms of, now that you've talked about postpartum depression, do a lot of moms come to you with how they're feeling afterwards? I mean, is it something that you noticed yourself? Because I know, again, this is one of the topics within Kenya that not a lot of people want to talk about openly, at least. So maybe it's something that they do behind closed doors with their OBGYN without anyone knowing. So I don't know if that's something that you get a lot, or...
So again, I like to teach as we have the conversation. So there is a bit of a difference between postpartum blues or postpartum depression, postpartum psychosis. So it's a bit of a spectrum. Okay. So every woman will go through postpartum blues just because of the change of hormones. So you go home with your baby, you feel a bit lost, you feel tired, you feel a bit sad most days, you feel overwhelmed, you're not too sure what to do with this newborn, and somehow you're supposed to automatically know how to be a mom. So postpartum blues is very common and also considered pretty normal just because of the change of hormones after delivery. But then if your feelings are extreme and they last more than 2 weeks, then you need to seek help. So if you can't get out of bed, you can't focus, you're feeling extremely fatigued but you can't sleep, poor appetite or loss of appetite, loss of interest in the general world, you're disengaged from the baby, that would be more towards depression. Or you're feeling extremely anxious, so you're now stressed out about everything. What could go wrong? Is my baby breathing at night? Should I put my baby in my room, or should they be in their own room? There's a lot, but you're taking it, you're not able to manage your feelings, then you should seek help. But then the reality with postpartum depression and postpartum psychosis is what we call lack of insight. So the person affected isn't aware how badly they're affected. So it's unfair to then say seek help, because sometimes you don't know you need help, or you think this is normal. Or a lot of times we see moms who are struggling who think they're failing. So they look at this from a guilt point of view rather than I need help. So then we ask the family to kick in. If you have support at home, if they notice that you're just out of it, you're not able to take care of yourself or the baby, or you're getting more and more stressed out along the way, they need to seek help for you and bring you in to see the doctor.
That's such a great point, because I went through postpartum rage recently with Nova, and even with Olive. I wouldn't say maybe it was postpartum blues, but I don't think it was as severe. But I do just recall it's after the fact that I was able to look back and think, wow, that was actually really difficult, and I was really going through a hard time. Or then I started journaling and making videos, and I'd be crying, and then after the fact I'd be able to look back and think, I probably could have done with a bit more help during that period. But you're right, you just don't see it when you're in it.
Because you're swimming in the dark at that time. So it's very difficult to then assume you're going to be able to recognize that you're struggling and that you need help. And that's where your community kicks in, because sometimes it's easier said than done when you tell a mom to ask for help. Much is better said than done, because in the moment she feels like, I'm supposed to be able to do this. I'm supposed to do everything. I'm supposed to be able to look after myself, look after my partner, or if there are other children, look after the other kids as well as this newborn. But that's too much. So we do need for people to plug in and form a community. Your friends can come in and help with cooking, with cleaning, with support. Whenever you need to sleep, we can look after your baby for you. So there's a lot that, and again, we are still in the bit kind of society here where people will help and people are willing to come in and assist as much as they can. So leaning into that helps a mom a lot to navigate that time.
Which again, I think is very much easier said than done, because you don't want to have to rely, at least my experience, I didn't want to have to rely on other people. Like I didn't want to have to show them that, firstly, I wanted help, but I didn't want their help at the same time, because, I wanted to do it for my baby. As much as I needed the help, I was like, no one can do it like me. Yet I'm there, not really capable of doing it. So it's so difficult. And then you also talked about like friends coming over and cooking and stuff, and I feel like that is one message I'd love to just send out to mums. Any support groups listening, if you have a friend who's just given birth, I wish you could just go there and take literally everything off her plate rather than sit there with the baby.
Yeah.
I feel like all she wants to do is lie down, even with the baby, and have things in the house taken
sorted.
care of.
Exactly,
For me, it was so hard when family and everything wanted to come over, but then of course you have to sit up. You're tired, you're exhausted. You have to sit up, make sure they have tea, make sure they have food, and that for me was incredibly stressful. I think you also touched on a normal delivery when we were talking about, you know, some of the high-risk pregnancies. I would want to ask you about C-sections, because I know there was one day I did a post on normal delivery, and then I said, in fact, mine was not normal, I was having a C-section, and then I got a lot of comments about a C-section is a normal delivery. So I feel like I don't want it. I was not saying it in a judgmental way. I mean, I think, you know, having a C-section is just, if not harder, than having a natural birth, or natural, let's say natural. So what is the difference there? Why are people so pent up on the term natural for CS or,
I think, again, we're getting more and more woke now. So when I say normal delivery, I'm referring to both a vaginal birth as well as a C-section. Because depending on the reasons or the risks and sometimes the health factors, the physical factors for the mom, a vaginal delivery is not possible. But am I going to say a C-section isn't normal? No, not at this point, because a large majority of our babies come by C-section. So the stigma, the issue is that we are correcting an old stigma where it was believed that women were not women. If you didn't prove yourself as a woman, if you didn't have a vaginal birth. So that's the stigma that we're overcorrecting now, because then so many more women are having C-sections. Does that mean I'm less of a mom? Does that mean I didn't achieve? I'm less of a woman? You know, such issues. So I think it's just being sensitive to understand that some people still have a little bit of stigma attached to it, and you feel you were manhandled during your birth because it was a C-section versus a vaginal delivery. But then we also know there's moms who had a vaginal birth and had terrible complications and then have trauma from that as well. So it's a bit of a balancing act between the two.
And have you guys experienced the Ashley mattresses and pillows? Honestly, there's no better quality sleep than on an Ashley mattress. And have you seen all the amazing furniture they have as well? Bedside tables, bedding, you know, the backboards, everything. It's actually really gorgeous furniture. If you're looking for a bed, this is where you should come.
So just again, also to be clear, a lot of stigma we assume arises from the men, but a lot of women's health and pregnancy related stigma comes from other women. And if you look at it traditionally, we used to have traditional birth attendants attend to you in your hut, and they would look after you. And sometimes there was a lot of loss, because either loss of the baby or loss of the mom, just because of complications not being handled appropriately. And over time, and this is, you know, years and years of medicine, where even when we started to have C-sections, it was to save the baby at the expense of the mother. Because there wasn't a way to keep you alive or even put you under to give you your C-section. So coming from that, a lot of societal beliefs around motherhood and having a normal, vaginal birth comes from your mom and your grandmoms and all those belief systems, in that I need to be able to prove myself as a proper woman and prove to my women in the village that, you know, I actually achieved being a mother vaginally, which I think is still unfair. We don't see it as much now in the traditional sense, but then we do still have communities where there's a lot of the maternal influence, and we do have a lot of resistance sometimes, even in the birthing suites. So we have some communities still here in Kenya where you'll have the mother-in-law sitting with you during your birth and refuse a C-section. Regardless of the medical need. And the belief around it is, oh no, we're not going to do that, because then we can't take you back home. You'll be shunned at home. So it's better to lose the baby than to have the C-section. And as a doctor, I can't endorse that. So it gets wild. It does.
That's really crazy. I would never expect that. But yeah, you're right. A lot of shame from parenting, I've found, comes from mums. And what I'm also realizing is there's some sort of, you know, inadequacy they feel about themselves, and they take it out on other people. I feel like that's just a human thing altogether. You know, when you feel some type of way about yourself, then you'll always take it out on somebody else who you perceive is doing something maybe that you wish you were doing. But what I've experienced is, a lot of mums shame a lot of mums, and we know how hard it is. We're there just ready to just make every mum feel bad, which is so terrible. So I'd like to know, maybe we can touch on some misconceptions that, a lot of misconceptions that maybe moms or people have around pregnancy, childbirth. Yeah.
Well, the first big one is that there's a right way to do things.
Okay.
That's the biggest one I can think of, because everybody, as much as we are different individuals and we all have our opinions, we all have our preferences, the way I would mother would be very different from how you would. And because you are so verbal and out there, you'll get a lot of backlash from some of the things that you do and the way you choose to raise your kids versus how someone else would choose to. And just giving each other grace is one of the things we should start doing.
Amen.
Because then we break down that traumatic experience of being a mom.
Yeah.
Then there's the mental, I don't know where it comes from, maybe it's also just learned or taught culturally, where a mom should be able to do everything.
Yeah.
Like, you had this baby, you should go back to being the sexy partner that you were before, be able to breastfeed this baby on demand, barely sleep, but look amazing, shower, be clean and look amazing, spotless house, every meal should be cooked. And I'm like, who do you think she is? Goodness, you can barely look after yourself on the best of days.
Exactly.
Now with a newborn, that's just too much.
Yeah.
So if we could just take a bit of pressure off mums, I think we'd come a long way just by being kinder.
Yeah.
Because then a frustrated and tired, exhausted mum is not a good carer for this baby.
Amen. Yeah.
I think those are the big ones socially I would talk about.
Yeah. And I think that's so true. I even feel like 3 months, what is it, maternity leave, is way too little.
Nowhere near enough.
I mean, I'm really lucky that, I never got maternity leave. However, the clients that I had were so lovely that they allowed me to bring a newborn baby on set where I was photographing. Granted, this baby's sleeping, the whole time, so they were never really getting in the way. But that I was really lucky that I got to carry them with me for, a year or so. It got to a point where obviously now they're a toddler, they can't come with me anymore. But I got to spend a lot of time with my kids, and I just couldn't imagine only having 3 months and then having to, have a nanny come in and look after your child.
And being at work with sore boobs because you
Exactly.
can't. Also, the fact that we even now still have a lot of companies that don't even have a nursing room or somewhere where mums can go in and, pump for their babies. It doesn't make any sense, because what is she supposed to do? What are your expectations?
Exactly.
We have abilities. COVID showed us we have the ability to work from home for a lot of companies. Why not accommodate this? As much as it's not in law that it should be more than 3 months, why not accommodate a flexible schedule for your new moms? I think women tend to be amazing in the workforce, and if we could just allow for them to work flexibly, your returns would be amazing.
Amen. We would do even so much better. So I would love to know, if you're comfortable sharing, what are like some of the worst kind of moments you've had dealing with mums in regards to like pregnancy, giving birth, some situations that you've had to deal with and you're like,
Is this medically or with the mums?
Well, both. Both.
One big challenge is misinformation. And now that we have social media, everybody's on TikTok giving their opinion as if they're a medical expert.
TikTok doctors, I've actually heard that term. Yeah.
And that's one of the big challenges we have as medical professionals, just because it's literally like, I'm going to believe TikTok and not believe my doctor. And I don't even know what to say about that. It's still one thing we're trying to navigate and the way we navigate it is by being online ourselves and making sure we put out as much accurate information to counter the misinformation, because that's one of the most effective ways. But then coming in and I guess bulldozing your appointment, demanding things that are not possible. And again, there's a lot of fancy birth plans that I see these days. You want a home birth, you want, white noise and blah, blah. And it's all well and good if you're in a third world country where you can have an ambulance to you and take you to hospital in less than 5 minutes. That's great. But that's not the reality we have here. And then also it's not something your doctor is ever going to be able to endorse, because a low risk pregnancy with a midwife birth, for those who are licensed to have home birth, then that's who is going to deliver you at home. It's never going to be the doctor. We're not trained or licensed to practice outside of the corridors of the hospital. Then we have, of course, pregnancy challenges just in general in terms of health, because sometimes it's difficult to give a medical diagnosis in pregnancy. And again, this can affect whatever medical condition we're talking about. It could be like you're epileptic and then you get pregnant and you have to manage that. If you're already struggling with mental health issues, you're on antidepressants and some are not safe in pregnancy, we have to work around adjusting that without changing your health. There's a lot of things that come into play, and I don't know there's one that I would highlight, but then the biggest challenges tend to be around near misses or losses during childbirth, and that's the big one, or pregnancy itself, where either we lose the baby or we lose the mom. I think those are the most devastating. Yeah.
And how would you take care of your mental health when dealing with?
It's become more acceptable for us to admit to having therapy ourselves. It didn't used to be. If you said as a doctor, I'm struggling mentally, I need to speak to a therapist, you were seen immediately as a liability for the health facility, which is crazy to me. But nowadays we are very careful to debrief either professionally or with each other, because then that's where our morbidity mortality meetings come into play, just to help support the person who's gone through, because again, in as much as pregnancy and childbirth is a journey for the family, your doctor is part of this journey, and it does affect us greatly if we have a bad outcome at the end. So debriefing is important. Therapy, debriefing with colleagues, because again, patient confidentiality, you kind of have to be careful. And then where possible, just supporting the family through the loss as well. You can't unload on them, but then you can help support and provide as much, colleague support around them as well, and that helps a little bit as well.
Wow. Yeah, that is also, it seems a bit crazy to me, because I can't even imagine having to go through that on a daily basis and then not being able to say that you need help with that. Of course, any human being would naturally need to have some sort of help going through that. You talked about having to your online space and how you're trying to educate people and get them away from also those TikTok doctors. Maybe you can share more about why you started your podcast and the kind of topics that you touch on and why you found it important to start the podcast.
My podcast is informed off of experiences with patients, direct conversations I was having, and especially so what I considered pretty basic information that we just don't have. So because as a country we still consider sex ed taboo, we then don't have a basic understanding of how our bodies work, what your menstrual cycle is and what is normal and what isn't, what you should be doing in pregnancy, what you should be doing to prepare for childbirth, how much accommodations are available here in this country, because again it's relevant to here. I mean, you can watch whatever you want to watch on YouTube, but a lot of it is not happening here in Kenya. So just that and the repeated conversations I was having where women just don't have even a basic understanding, and the fact that led to a lot of shame. So you would have shame around something as simple as vaginal discharge, and yet it could just completely be normal. But if you talk about it with people around you, the first accusation is it's an STI, so you've been promiscuous somewhere. But then I mean, and the trauma that comes with that, by the time you come in to see the doctor, first of all, you've done everything else. You've gone and done your herbal thing, and then you've gone to the chemist and done over the counter, and which is another dangerous practice we still have here in Kenya. The big challenge, of course, now is demystifying and debunking so as to remove the stigma. So my primary reason for doing it was just start off with the basics, get people to understand what normal anatomy is, what your physiology, how your body works, sexual reproductive health, debunking, demystifying sex, because I don't know why we want to act like it's, oh my God, we can't talk about it, but then we're all doing it. So really, and then because of that, then the kind of STIs we see here in this, especially in the city.
Oh, you must see a lot. This is very interesting.
It's actually crazy. So then to think this is just because of a lack of education and lack of information, I was like, somebody has to do it. And it's tough because I then focus primarily on controversial topics, which I, again, just because of my training, I think, don't come off as controversial to me. But then the second you put out an episode, you read the comments, hear the feedback and go like, huh?
I didn't think that was so controversial. Right. Because you're putting out actual facts, and I've been talking about some certain topics just from my own perspective, and I already get those comments. And even to me, it's just like, but this is
isn't this what you face on a daily basis? Why shouldn't we be talking about it?
Exactly. This is so natural. We're all going through it. We all went through it as kids. So why is there so much shame? Why are we so scared to talk about it? I know for a fact you're going through it as well. So what's the problem, you know?
So just having more open conversations around that. I think I have the privilege of being a medical doctor, so I don't suffer as much backlash when it comes to having these conversations, because I'm not having it socially. This is not for sport. I'm not having the very extreme versions of the conversation. It's literally just the basics. And the more information and education we have out there, the better. I think because we've always been shy about it, we also have very different personal opinions as doctors, as medical professionals. So sometimes you will go to a different gynecologist and they have a different opinion. Some people, for example, something super controversial would be if you're pro-choice or pro-life. And I don't think personal preference or opinion should come into play when I'm your doctor. It should be about you as the patient. So some of the education is also aimed or targeted towards colleagues as well, just because we didn't have that much education around the topics themselves, around matters to do with sex and sexuality. We just didn't have, I mean, it was a paragraph, if anything. So then just demystifying, helping people become more and more comfortable having these conversations, because I think it just boils down to, can I have a conversation openly with my gynecologist? Because if I can't, then who can I talk to? So some of that is also just to facing the professionals as well and challenging us to think broader, educate ourselves more, keep in tune with the times as well, because people will get the information. It's better if it comes from the professional so that it's accurate.
Amazing. And then you talked about, you know, your personal opinion shouldn't come into, you know, it's all about the patient. So how do you then get through some of these clients that might have a completely different personal opinion than you do? How do you work your way around that?
So basics of how we practice is usually give you all the information available on whatever the issue is, and then allow you to make an informed decision. Now, if your personal opinion and informed decision doesn't align with what I can do as a person, if it's against my own personal morals or beliefs, it is my duty to then refer you ethically to someone who is able to look after you properly. So it shouldn't be that my limitation, and this is the same to do with skill. So if you came in and you needed surgery, and the kind of surgery you need I'm not trained in or I'm not proficient in, I should responsibly refer you to a colleague who has the skill, or bring them on board in terms of bringing them on to look after you as part of the team. So then we need to encourage this more, because the training has always been, I need to look after this person since they came to see me from start to end. But the way we practice now, multidisciplinary approach in medicine as well as evidence-based medicine, you shouldn't force a patient to do something either they're not comfortable doing or to have a procedure that you know there's a better option for. So that's sort of how to look and approach the medical aspect. Because then if you remove everything else, just focused on medicine, the patient is the primary decision maker. So my role is to help you make the best possible decision with all the information at hand.
Amazing. What's the most controversial topic you've discussed on your podcast?
Sexuality. Sexual identity and sexuality. That's, especially here in Kenya, is such a taboo topic. And then also conversations around abortion and abortion care. So that's another one. So anything that sort of touches on morality or anything that's considered governed by the religious beliefs tends to be something that's almost a no-go zone when it comes to having conversation. For example, for the sexuality one, because I started off by having sex ed conversations, in fact, I think I had you on.
We had the sex ed conversation, right?
So just talking to parents to see how they approach the conversations around sex or sexual identity of their children. I then also had an episode where it was more focused on HIV stigma, because then the focus of the conversation was having a young person come on board who is HIV positive and has been doing a lot of amazing work in advocacy online. And then the problem that happened to come in for the audience was that this was an openly gay person.
Yes.
And he's talked about his sexuality very openly, even online. And the feedback and the lashback was because of his sexuality rather than the conversation around HIV. And but again, we have to make room for these conversations. When it comes to the abortion conversation, again, it boils down to the belief system that it shouldn't even be available. It shouldn't even be possible to ask for an abortion or to have an abortion. And yet we find that in this country, we have so many preventable, really bad complications or deaths, because if we were able to provide services safely, then, because also let me just be clear, if a woman has decided she's terminating a pregnancy, nothing you can do is going to stop her. And all you're going to do is push her underground. And we know that there are those providers, they're not doctors a lot of the time. They wear lab coats. Please stop believing that everyone in a white coat is a doctor. Even my butcher wears a white coat.
Ooh, okay.
Wow. So then they'll seek out services. They'll be told this is a doctor. They'll be told this is a medical professional. But some of the things we see being done, you asked me my most traumatic, this just came to mind. As an intern, I had to surgically remove a hanger from a woman's uterus. Because they used a hanger. They inserted a hanger to terminate the pregnancy. We've pulled out various types of tree branches because they're traditional herbs that will be shoved in to try and terminate. It's horrible. And the complications that come from that sometimes lead to loss of life, sometimes lead to long-term complications and issues with having to have a colostomy bag the rest of your life because you can't use the bathroom normally. It can be quite traumatic. So when you see those outcomes, a conversation would be nothing. As far as I'm concerned, I'll push for the conversation any day.
Yeah. That's really sad. That is. Sorry, you know, get like heebie-jeebies.
Try not to traumatize your audience as well.
Honestly, no, but it's good. I mean, people should know, and I think, I mean, obviously, I don't have the discussions that you're having. Mine are very like surface level about, you know, some of just the hardships we face as mums. And I think people already don't know that side of things because people just assume it's like you give birth, you're in love with your baby, you put them on, you go home, happy family. And there's just so much more on the other side of that that I wish people would educate themselves on beforehand. Just because I feel like being informed is really important. And then, you know, you're able to have this child and knowing more about what to expect than coming into it not knowing and just facing like a lot of hardship, I think.
There's something else just to mention. Putting too much pressure on mums in terms of being automatically feeling like a mum. That's something that, so people assume that the mum and child bond is automatic and natural. Sometimes it's not. Sometimes it takes a lot of effort to feel attachment and bonding with your baby, especially so if you're struggling with mental health issues as well. So putting that pressure on mums, I think, is really unfair because I have had lots of mums who are my patients who, after the birth, would prefer not to be with the baby, would prefer to rest, so we'd keep having baby sent off to nursery so that she can sleep. And then I have to come and check in because I can't release you safely from hospital if I don't see at least a bit of a bond, a bit of, you know, you've established your breastfeeding, you're able to handle the baby's routine already. If we don't see that, I can't send you home because then the postpartum depression aspect kicks in. So just give moms a break. Take also for moms, if you're pregnant, if you've just had a baby, take the pressure off, honestly. Do things as you feel you can and ask for help where you need to.
Amen. Again, asking for help. It's a big one. And then I think I end every episode where I ask my guest if they have any regrets about, you know, parenting. However, in this case, maybe I guess in your life then, I mean, are there any regrets leading up to, you know, being an OBGYN? Is there anything you would have done differently? Maybe.
I love what I do as an OBGYN. It's been the most rewarding. It wasn't a natural decision because when I started, I mean, anyone who has had a baby or assisted, I think more, let me say, anyone who's assisted in the delivery of a baby knows there's nothing pretty about it. There's nothing cute. So I remember because we first did our obstetric rotation in 4th year of med school. I remember walking into labor ward in Kenyatta National Hospital and going, ugh.
Imagine.
Ugh. who would do this?
Have it or deliver it?
Deliver,
or both?
or both.
Yeah.
For me, it's both. It was both. But then internship was the first time because it was the first time I had contact as the direct doctor, looking after you from the time of conception all the way through the birth. Being part of the journey actually is where my mind changed in terms of, this is a beautiful journey to walk. It's quite literally happy medicine, because as much as when things go wrong, they can go really badly wrong. That's also very rare. It's not the most common of things. So it's happy medicine. I walk a journey with you. We start from where I show you that dot is your baby, and then we go all the way to here's your baby, hold your baby. And it's a beautiful journey to walk. So I don't think I have regrets. I do have regrets in terms of the healthcare system that we have. That's one of the things that still angers me quite a bit, because we have failed our moms in terms of access to healthcare when it comes to the general public. So not the privileged, not those who can afford private insurance or are able to go to private hospitals, everyone else. Because in 2024, we still lose mothers because they can't get to a health facility with professionals or equipment for a safe delivery. And I think that's one of the struggles things I still struggle with, because we downplay it, because then the middle class don't know any better. You don't know that it can be really, really bad out there. It's until you've been in the village setting where you know, if you think about it, girls still don't have access to pads. Why do you then imagine she has access to good healthcare when she's pregnant? Why would you imagine she has a safe place for a delivery? That's how we need to start thinking about things. So I will advocate until I go sore. I'll make as many enemies as is necessary in the process, just because it's a fight that someone needs to fight. And the more we talk about it and more we hold, especially in the environment, I love that we are pushing back on the government, and the more we demand better services, because we are paying for it. You already deducted from your salary that you have a national health scheme. Why doesn't it serve you? That's the question we should be asking. Because one of the challenges I have just generally in Kenya for Kenyans is you pay for healthcare at least 4 times. You pay naturally, directly through your taxes, through your deductions from your salary. You also pay cash, because sometimes you'll go into the hospital and they'll say, no, we have to have a cash deposit. So you end up reaching into your pocket and paying cash. You then also have private insurance that either you're paying for or your company is paying for. But then these are deductions, again, still from your salary. And then there's the community, because how many harambes, how many times do we come together to raise money for someone's healthcare or for like funeral expenses? Why? The question is why? Because given how much we raise just from deductions from your salary, you should have amazing healthcare. Walk into a healthcare facility, have the best professionals, and have access to the best quality care. And we have demonstrated as Kenya to be leaders in healthcare in the region, but we still want to insist that we're not capable. That's just wrong.
That's really sad to think about, actually. You're right. Like, I've never really thought about that, and that's just making me feel a little bit sad that, a lot of people are going through a hard time, and
it's difficult. And again, in 2024, the things that we still see out there for the doctors who are working in the rural areas, for the limitations, because you still have to send patients away because you don't have drugs, you don't have the equipment. I remember during my internship doing C-sections with the Mulika Mwizi, we didn't even have smartphones at the time. But the power goes out. What do I do? You're on the table. What do I do? So have somebody hold the torch on my phone so that I can complete the procedure. It's crazy. That still happens today.
Is there anywhere that we can, maybe I can put the details down in the caption that we can have a conversation, but maybe like anywhere we can, as people, like help out or donate, or I don't know, is there anywhere that we can help with this?
I think it's more holding our leaders accountable, because this is not something we should reach into our pockets again. NHIF exists. Let it work for us. And it's that simple. Yeah.
Hey guys, I'm at Ashley Furniture Home Store, and I'm here to check out a few pieces from my home. I'm looking for something child-friendly, pet-friendly, and all around comfy on the pocket. And yeah, I really love the furniture here at Ashley, so why don't you come and have a look around with me? Would you have any advice for expectant mothers, those who are able to afford, you know, services like yours, and then those for general public who might not be able to afford them?
Right. If I look at expectant moms who are able to access, you know, quality healthcare, start by finding the right fit for you in terms of your provider. So part of the journey will be, can I have conversations with my provider, whether it's a midwife or an obstetrician? Can I ask questions? Because if you don't feel comfortable enough to ask questions, if you don't feel like you have enough time with them, then it's unlikely you're actually going to have a satisfactory pregnancy journey with that individual. If you're in a hospital setting where you don't really have as much control over who you see, I'm big on advocating for the patient. So I ask patients to advocate for themselves, come in with a list of questions. Pregnancy brain is real. You're not going to remember everything you wanted to ask your doctor. If you see something controversial online, if you don't know where to search, if you have questions, your doctor should be able to give you the resources. We know all the sites to go to, we can give you information. So start with someone you can actually walk this journey with comfortably. Then, and like I said, even if it's not an individual, at least an institution that allows enough time for you and your provider to have a conversation. Then the second thing would be making sure you're on a good, healthy diet and the right supplements that as prescribed by your provider. So just walking the journey, it's a physically straining journey, and a lot of it will be made easier or less complications are likely to arrive if your nutrition is great, and then if you're active throughout the pregnancy. We take it for granted that a vaginal birth will just happen on its own. The more active you are throughout the pregnancy, the more physical and fit you are heart health wise, the easier the delivery process will be. And also the easier the recovery, because if you have a C-section, the foundation, the way you've been eating, the way you've been working out will help you recover faster, because it's surgery like any other surgery.
Wow, I think, sorry, I always got a lot of questions because I recovered quite quickly from what I understood from other people's experiences. I don't know, I had my own, but I just even remember like a week after, I was already like, you know, up doing the kids' hair, taking them to school, and I just feel like my body was...
because you're fit and
and I continued during my pregnancy, so I think, maybe,
it makes a huge difference, because pregnancy makes it so that you don't feel like it. You don't feel like you should be working out. You want to eat all the junk food in front of you. Just don't resist.
That was actually so hard. Even thinking about it, my gosh. I remember with each one there was like donuts, and I had to have. Firstly, I've never had Krispy Kreme donuts from the States ever, but that was all I was craving, and I was like getting these donuts from all sorts of places. I was like, this is not Krispy Kreme. I have no idea what it tastes like, but in my head, I knew what I wanted. It was so hard.
So you kind of have to find a balance. I'd say don't completely restrict yourself. If you have a craving, have a little bit and then move on, but then at least 90% of your diet should be really good, and then making sure you're exercising. Don't start CrossFit if you didn't do it before. But if you were in the gym, if you were active, whatever kind of activity you were engaging in before, with a bit of modification, you should be able to continue most of the pregnancy. So that would be big advice. Then birth plan. We don't talk about birth plans enough, but you should start to think about your birth plan from the beginning. And what is a birth plan? So the first thing you're thinking about is who your provider is and where you're going to deliver. So you're looking at hospital. I'm not going to talk about home births because I can't, but then hospital or health facility where you're intending to have your delivery. Go and visit, see the place, make a decision. Second thing is finances. So you need to prepare as much as possible, find out what your insurance covers, and then find out if you need to top up, how are we going to do that? And then the next thing is, how am I getting to hospital? So towards the end, you need to have a plan of action. If my partner is with me, can we get there together? If I'm by myself, who's taking me to the hospital? If it's peak traffic time, do we need to get an ambulance? You need to think about all of these things so that you're not caught unawares. And then have a conversation with your provider about any danger signs, the things we talk about that need urgent care throughout the pregnancy, so that you know this is something I can manage versus this is something I need to go in and have sorted. Then also now what to bring to the hospital. That will vary depending on the facility, because a lot of them, especially private ones, will provide a lot of things for you and the baby. So just find out what you need to have in your bag. Stop coming in with suitcases. It's not a trip, guys. We don't have the space.
It's TikTok again. Like, what? Pack my hospital bag with me, and it's just like,
it's like a whole
30,000 things.
I'm like, no, no, a little bag or the little carry-on size suitcase, that's more than enough, because it'll be more what you leave the hospital with, which can actually be brought in towards the end for most hospitals. Then in the general public, where you have access to public or mission hospital healthcare, follow the protocol, because we do have a protocol in place. Some places it's 4 visits for the pregnancy, some places it's 6, and that's just because of limited resources.
Okay.
Make sure not to miss your appointments, make sure to maximize each appointment and ask all your questions, and then prepare as best as you can for that facility. So again, go visit. It's within your right to go in and ask to see what labor ward looks like, where will we be housed in maternity afterwards. It's your right, and most hospitals will actually send someone around with you to show you the facility, so don't be shy about it. It's better to be prepared, even physically, to know where I'm going, to also know where labor ward is. I have patients who get lost in the hospital just because once labor kicks in, everybody forgets everything we talked about before. So the more prepared you are beforehand, the better.
Okay.
And that's just a few things to think about when it comes to the birth plan. Otherwise, then it's listening to your body and doing what you feel works for you. Another good question people will ask, or maybe not, maybe shy away from, is sex in pregnancy and whether it's safe. So yes, it is safe for the most part, unless there's a health issue and your doctor limits you. It's also, your baby's not going to be aware. It's not going to traumatize them. It's not going to hurt them in any way. And then depending on what you're comfortable with your partner, you can always find other ways to be intimate if you're just not on it. But again, hormones in pregnancy can be one way or the other. Some women will want to, others won't. So you can also vary that as well. I think those are the main things I'd highlight.
Amazing.
Yeah.
Okay, and then our experience. Touching on our experience, I think it went really, actually, I feel like I had a really fantastic...
No, you had an amazing first pregnancy, from what I can remember.
Yeah.
The thing that stood out for me, you were nervous, but you asked questions every single time. And then your family was very supportive.
Oh yeah, my dad was always in, right? Yeah,
your dad came to every appointment.
Exactly. Actually, it was me and my dad always.
Yeah, so that was a beautiful thing to see, because then the fact that I knew you had support almost throughout was amazing for me, because then it takes the load off as well. Because if there are women who will struggle just because there isn't enough family support or social support. So that's a big thing. If you do have the support, if you know the people you want to be present for you. Oh, that's another good thing to mention with your birth plan. Your birth partner, who you'll have during the delivery is key. It doesn't have to be your husband or partner.
I definitely feel like it. I mean, no matter how rocky your relationship with your mom, I feel like in the delivery room, she's your cheerleader. Okay.
Sometimes.
Really? Okay, yeah.
Let's just go with whoever you're most comfortable with.
Okay. For me, I just felt like there were things that were happening, and I just feel like she was really in my corner. But then you're right. Yeah, it's obviously
it just
the
depends.
person that is
the
in your
one
corner.
who you feel can. The way I say it to my patients is the person you're most likely to listen to when you don't want to listen to me. That's how I put it to my patients, because at that point, emotions are high, you're in pain, you're pushing, I'm giving you instructions, I need you to do it a specific way, but you're not listening to me.
But it's impossible.
So I need you to have someone who, if they say something, if they help you, you're
listening.
You're listening, you're receptive to them.
I just found that incredibly impossible. I don't know, people say, even the nurse, I remember her telling me, Tatiana, we were friends, what's happening? I was like, you're telling me to walk, I can't even you're just...
It's a lot.
Can you guys, can everyone get out? I was so upset. Yeah,
it's a lot. Yeah.
Okay. And then can I just ask one last question about, when I was having a C-section, I was given this medicine to put, to get to sleep. That is the most painful thing I've ever endured in my entire life. Like
what the IV?
I don't know. There was something that I was given to be put to sleep while I was, because I didn't want the injection in my back. Actually, I was going to do that, and then the time came and I freaked out. Firstly, I don't like injections anyway, and then in my back, it was a no for me. And we were already scheduled to go in, so I was in the hospital room. And everyone is chatting like it's just like a normal Monday morning, or whatever it was. And then I was given something in my arm, and I just remember it was about to fall off. I don't know. It was the most painful thing I've ever experienced in my life, more than the C-section.
It shouldn't be.
Really?
No,
okay.
It shouldn't be.
Oh, okay.
That might not have been a good line.
Oh, really?
It shouldn't be that painful. It can be sore, but then also our experiences with medication is different. But then it shouldn't be that painful.
Bad? Okay.
I don't think I've heard of many other complaints. I don't think that going to sleep medication comes up a lot.
Oh, wow.
No. So I'm sorry about that experience.
Anyway, it's done and dusted.
I have a question for you before we wind up. motherhood, now that you've done it 3 times,
Ooh, yeah.
tips and tricks.
Oh gosh, there are none. There are no tips. It's gonna be hard, and it's just like painful, but it's also just the most amazing journey. And I feel like, as you're saying, everyone is different. Just like with, you know, how you're saying everyone's pain threshold, or like everything is different with every child. I've even learned that once you think you have it down, you think you have motherhood on lock, then you have another baby and you're like, well, you can throw all of that knowledge out the window, because this is completely different. And each child is different. And I think one of the things that has made my parenting journey a little bit easier is not trying to clash with them all the time, giving that they just as much as adults want independence, is one thing I've learned. They want to be in charge of something, and they want to be independent, and they want to feel like that, they're in charge. And I feel like as parents, we say no so often, and it's our way or the highway. And that ends up, like, I end up clashing with my kids a lot more when that happens. So learning to allow them to feel like they're in charge, saying more yeses, you know, allowing them the space to be in charge, to be independent, to let me know how they would like something done. Giving them that space has just made our relationship so much better, because they feel like they're also, you know, they have their space in the family. And I'll say no when it's really something that's important. And that just has created a lot less backlash, a lot less fighting, a lot less clashing with my kids. I feel like that's one. Maybe another one for me specifically is just allowing my kids to be kids. Again, often I feel like as parents, we just, no, you can't get dirty, don't jump in that puddle, don't go out in the rain, don't do this, don't make a mess when you're, you know, don't crack the egg on the floor, shouting when something is broken. But we often forget that they're kids, and they, firstly, in terms of breaking things and, you know, being messy in the house, I feel like this is how they're going to learn.
That's how they learn,
I mean, you only learn not to crack an egg on the floor when you learn how to crack it correctly, and you're only going to do that if you make the messes. Allowing them to get dirty. You can wash your kids. Like in Kenya, we have this thing of like, they cannot be dirty. Like they're in a white dress. You know, they must be pristine the entire time. They must sit still. And like, what kind of childhood is that? At least for me, I feel like it's so important to allow our kids to just be kids and just enjoy their life. There'll be a point in time where we're working from 13 for the rest of our lives, or even from 6 actually. We put our kids in prep school, you know, like, so from 6 until the rest of our lives we're sitting down working. Allow them to have some space to
enjoy childhood.
To enjoy childhood. I feel like.
And then a question I think a lot of your audience would want to have asked, because I'm sure you're asking it, but you maybe don't get the chance to answer it. How do you look after you?
Ooh.
How do you take care of Tatiana?
Actually, CrossFit, you know, honestly, that 1 hour in the gym a day, or whenever I can make it, actually, that's my 1 hour for myself. And I just, I let it all out on that. There are times where I'm doing a workout and I'm crying, and I feel like it's just all my stress just coming out from everything. But even more than that, I think you talked about it quite a bit, is finding that support. And, you know, initially, and it happened with all babies, especially when they're really young, I found it very difficult to be able to rely on anybody to take care of my kids. And it's not because I didn't need it, and it's not because I didn't want it, but somehow, like, my body just did not I wasn't comfortable with anybody helping me with my kids. And I feel, third pregnancy in, now I've understood more and more, you can get support in ways that you're comfortable with. So it's not necessarily like, please take my baby away from me. It's literally finding somebody to do everything else while you're with your baby, sleeping while your baby sleeps. That's obviously impossible when you're doing everything else. But if you have that support handling everything else, then you're able to have that time with your kids. So I think finding the support that works for you, I've been able to do that. And that's been really helpful. Like, even now, a simple thing of a meal prep plan where I know what I'm eating, taking that stress off my mind. My nannies know how to cook it. That has opened up, and it's only happened in the last 3 weeks, you know. But that's like opened up a whole new world for me in terms of self-care. Self-care. So finding that support. I think you've talked about it a lot, and I think that's one of the most important things.
So another thing I think is really important for us to mention is the fact that we're very far behind in Africa and a lot of other areas in the world, like in Asia as well, where we have very, very high mortality rates for moms. So what we call maternal mortality, morbidity and mortality. And it's usually from things that are completely avoidable. So we lose mothers from situations that in the right healthcare system, in the right if you had the best services available, you wouldn't have these outcomes. And we also have still have very high infant mortality and newborn mortality. And unfortunately, it's our reality because of the failures we have in our systems. And access to healthcare is so important, and just the basics, such as supplements. Being on iron supplements, we take it for granted. When you come in and I give you a prescription, you take it for granted that the doctor said to take this pill. But it keeps a lot of women alive in the long run, because again, our highest maternal mortality is still from postpartum hemorrhage, which is bleeding after delivery, which is ridiculous to imagine. You've had your baby, given you your baby, and I can't stop the bleeding. And if you are anemic to begin with, then this is a whole life and death situation. So it still breaks my heart that we still have the statistics that we do, but I think it would go a long way that as we hold our leaders to account, we also start to demand better services. And this is where I think patient advocacy comes in. If you are in a situation where you've had a baby or your loved one has had a baby and you're noticing symptoms that you're not comfortable with in the immediate postpartum period or as you get home, speak up. Come back in, have a review as soon as possible. Don't assume it. Don't say, oh, I decided I'll wait and see. No, some things are life and death. And then also just having more education, because I think if we were able to have women educated from an early age as to what to expect when it comes to motherhood, what the demands will be, what the reality is financially, because we don't talk about this. We don't talk about the financial strain that comes with having, from pregnancy. You think about when the baby comes. You think about looking after the nappies, buying the diapers, and the formula if you need formula, or the different things that you need to be able to raise your baby. That's where you first think about it. But pregnancy itself is expensive. Childbirth is expensive. Just paying for your delivery services is expensive. So educating and empowering women would go a very long way, just so that we have better outcomes long term. A lot of women I know have various reasons maybe why they wouldn't want to have a baby, but there are those who have keen passion, but they can't see how to do it, because you can't see how to do it financially. You can't see that the social support just isn't there. Sometimes even partner support isn't there. And then we still have stigma, you would know best, around single motherhood. We still have a lot of stigma and shaming around that, and yet that's the present parent.
Honestly, I feel like this is a whole other conversation, because I also, every time I mention single parent, it's
it's war.
It's war, and I'm just like, what are you talking about? I'm literally taking care of my, as you're saying, I am the present parent. What are you?
Exactly.
Anyway,
exactly. So because of these issues, a lot of women will hesitate with having going through the experience of becoming a mother, and I think it's unfair, and there are things that we can address even as society, because again, you'll have the older folk lecturing us about not having babies. You have lots of people going, oh no, but it's, the baby comes with the plate. Like, that's true. Anakuja na sahani, but who puts the food on the plate? Right?
And not food ain't cheap.
That's true. So I think more support, more education, and more empowerment, just economical, financial empowerment, so that, because women tend to be the biggest decision maker in the family, in the communities, the more we empower them, the more better outcomes we're going to see. And then if we also empower them with great facilities, a healthcare system that actually works for them right from puberty. Don't start from the pregnancy point, because a lot of the first contact we have with women as healthcare providers is in pregnancy, which is unfortunate. And there are so many things that could have been preventable in terms of a bad outcome at the end of this, if we were able to address her care from a very young age and able to support her, because even the state you're in before you conceive will determine a big part of how that pregnancy is going to go. So we should actually start this conversation from very early on. The fact that you can't conceive because of your menstrual cycle being off, because something is going on and you're not ovulating, that's something we should be able to address right from the point where it's an issue, rather than waiting to have multiple fertility treatments later. So there's a lot that we can do in terms of preventive medicine, just by providing education, information, and then access to proper health care.
Amazing. Okay. Wow. Well, thank you so much, Dr. Claire. Maybe you can just let for everybody watching, where they can find you on your socials.
Socials, I'm pretty much everywhere. So at dr.claire.kinuthia. That's Instagram, TikTok. I'm on the podcast is on YouTube, Spotify, and all other audio platforms. That's Circling the Rabbit Hole, or CTRH podcast. Where else? I'm not really big on X. That's just scary territory.
Yeah, no,
So
because everyone is just so rude on there,
Yeah.
you know.
I don't have the strength
To do that.
No.
Same, honestly.
Yeah.
Okay, well, I'll leave all of those handles down in the comments below. And yeah, thank you so much for being on this
Thank you
podcast.
for having me.
Being on my journey for 8 years now, actually.
know, right?
So yeah, thank you so much. And thank you for all of you who are watching, and I hope to see you on the next episode.